This is a significant expansion to be sure.
The first over-the-counter birth control pill, called Opill, will soon be available at the pharmacy and even online. Dr. Spencer McClelland, an OBGYN at Denver Health, says this expansion to reproductive freedoms will benefit women in Denver and all around the country.
It's something that we're tracking as an option for our patients because we're always looking for the ability to expand access to birth control, especially given that barriers to birth control tend to be something that our patient population at Denver Health has to worry about when it comes to insurance coverage or ability to pay.
When it comes to accessing birth control or staying on top of a regimen, one barrier facing many women is the need to come in for a visit to get a prescription or contact providers to get an updated prescription. A study from KFF found 1 in 3 women who use contraception say they've missed their birth control dose because they couldn't access the supply they needed on time. Dr. McClellan says Opill could break those barriers down.
I think this is a really exciting moment in terms of access for reproductive care. And the part that I think is really exciting is not just that something has been added as an option for patients, but that it's in a way that is specifically trying to think about what barriers there are for patients accessing birth control.
This over-the-counter option comes at a time when pharmacists in more and more states, including Colorado, can write prescriptions for birth control in the pharmacy, bypassing the need to see your doctor altogether. But McClellan says don't skip out on those annual appointments. Beyond the birth control prescription, he says those checkups are critical when it comes to identifying health concerns early on, particularly with cervical cancer screenings.
There's so much more than just birth control prescriptions that come from annual exams. There's a lot of health screening like pap smears and other healthcare screening that we want to make sure people still come for.
Now, doctors say with Opill specifically, it may not benefit as many women as other medications might, and that's because it's a progestin-only type of birth control, whereas most are a combination of progestin and estrogen. But he says the FDA making Opill accessible over the counter is still a massive step forward, and we could see other forms of birth control follow suit.
Pretty interesting. Okay, Rachel, thank you.